And we are live, Senators.
Okay, good morning. This is Senator Dave Weeks, the Vice Chair of Senate Health and Welfare Committee. It's February 7, 2023. We're going to kick Senator Lyons, our chair, will join us shortly. She's got another meeting to attend to for a few minutes, but she can join us shortly. So in today's agenda, what we're going to do is kick off with S56, an act relating to child care and early childhood education. We're going to do a deep dive into child care funding review and and provider and the provider landscape. We have invited in and have with us Ray, Deputy Commissioner, Child Development Division, Department of Children and Families, along with Carolyn Long, the Director of Operations for the same organization, and Megan Smeaton is joining us online, or is
she's just there in case the questions about funding.
Very good. And Megan is a financial director of the same organization. So with no further delay, if Miranda, if you'd like to begin. So we're sharing a presentation online as well for those that can see.
Great, thank you. Good morning. For the record, my name is Miranda Gray. I'm the Deputy Commissioner for the Child Development Division, and I will have Carolyn introduce herself as well for the record.
Good morning, I'm Carolyn Long, the Director of Operations for the Child Development Division.
Thank you for having us today. So what we have planned to go over is the Child Care Financial Assistance Program, the rate structure and the eligibility criteria. We were also asked to speak to the child care funding for non-citizens, just a broad overview of child care funding in general, and then the breakdown of child care facilities and providers. So what is the Child Care Financial Assistance Program? It is administered by the Child Development Division, which is out of the Department of Children and Families, with its mission to improve the well-being of Vermont's children. The program provides some or all the cost of early care, early education, and school-age care for eligible families. This helps ensure all children ages 6 weeks to 13 years of age, 19 years with those that have special needs, have access to quality child care. The Child Development Division contracts with 11 community child care support agencies in 12 AHS regions, the Agency of Human Services regions. I'll try to not use acronyms. We have specialists in those community child care support agencies who both help families find child care providers, and they also help determine if families are eligible for child care financial assistance. The program assists many different types of families, whether caregivers, are students looking for work, retired or working. And in fact, a family of 3 with a household income of $80,000 a year qualifies for some assistance. Our current budget is $62.75 million, which is a combination of general fund and federal funds. And I'll go into the funding stream a little bit later. So currently, our child care financial assistance rates are determined upon using the 2019 market rate survey. The market rate survey is a survey that goes out to providers to ask them what are they charging. Now, this will be important context as you review S56. So it is on the 2019 market rate survey, and then up at the 75th percentile. So the 75th percentile is important because that says out of every 75 out of 100 child care providers that exist, families would have access to those programs. And that was a move that we made this past July, was moving up to the 75th percentile. The Child Development Division has a set cap on what the state will pay on behalf of a family. And I have a chart that will show that. The state pays the capped rate or the provider's rate, whichever is less, after subtracting the family share. If a family uses more than one child care provider, the family share is paid to the provider that cares for the youngest child first. And this is because care for younger children is more expensive, generally speaking. The portion the state will pay, if any, for an eligible family will depend on the family's application, the provider's rate agreement, the state's capped rate, and the amount the family is obligated to pay. So these are our capped rates. So effective this past July, If you look across presently, so in a licensed facility for an infant, if the program is 5 stars, the state will pay $349 a week. And then if you look over at registered homes, the same, an infant at a 5-star program would be $225. And it goes up from infant to school age of what the state is paying on behalf of a family to a child care program. I think that's the important component here, is that this is a benefit for families, but is paid directly to providers by the state.
Can you take a moment and differentiate distinction between licensed care and registered homes, just set a 10,000 foot perspective?
Yes.
Folks can understand how they're delineated.
Yes, so I will do my best to do that. So we have both licensed and registered homes. The regulations are a little bit different, but then we have our center-based, which is licensed as well. So we have, it's like 3 distinct groups. Centers take care of more children, generally speaking. Family child care homes are taking care of less children, but we have some family child care homes who say do have an additional staff member, and so they can care for more children. And by following a few more regulations, I say a few, I don't know the exact number, then they could also become licensed.
Okay. So is it done by number of children? Is the distinction between number of children or services provided or facilities?
So a combination of children provided. So family child care home is capped at the number of children that they can serve. And then also there are other regulations that you have to follow. So if there is a family child care home that would like to become licensed, there are additional regulations, which I'm happy to get what those are for you, if that would be helpful.
It would be
Okay.
extremely.
Yeah, definitely can do that.
Thank you.
Yep. The next slide goes into how our families or caretakers found eligible. So to be eligible for child care financial assistance, a family must, or a caretaker must, have a reason for child care. So they must have a job, they have to be self-employed, looking for work, attending school or training, participating in our Reach Up program, which is out of our Economic Services Division, or has a special health need and need help caring for their children. So that a parent or caretaker has a special health need, or the child has a significant health or specialized development need. Or lastly, their family has an open case with family services. They also must meet income guidelines. They must be a Vermont resident, and the child receiving care must be a legal resident of the United States. Then I included a citation, our federal regulation, which states you must be a parent. It's really just reiterating what I said, but I thought it might be helpful for the committee to see where this is. So this is, once again, saying you have to be a primary caregiver responsible for children under the age of 13 years of age or under 19. You have to have a financial situation that would be characterized as low income or very low income. So child care financial assistance per federal statute is for lower income families, which is why we have a combination of funding.
Is it relatable to federal poverty index? Say low, or I mean, those are just words, but is it?
Yes, so the federal poverty level, yes. So at 350% is pretty much the max of what the federal the Office of Child Care would say qualifies. Anything above that is no longer considered low income.
So I know the answer to this, but I just want to double check. So if in Vermont we go above the federal guideline for what they consider low and very low, we use state funding to pay those CCFAP payments. Yeah.
Correct. Generally speaking, I will just always caveat that, like, you know, there could be a family that is involved with family services. And then there's different eligibility criteria that we would run each scenario through. But generally speaking, yes, when we're talking about a higher income like that, that is when we're talking about our general fund.
And I'm assuming that we use federal funds first. Yeah.
Yes.
So this is how it is currently? Or,
Yes.
okay.
Also, that you must either be employed or in some states enrolled in a training or education program. So you'll see from the previous slide that Vermont has encompassed, more activities that are related to employment to be eligible for childcare, but this still is a federal regulation that you have to be engaged in the work-related activity or have a special health need, et cetera. And then also just presently, non-citizens are not eligible for childcare financial assistance.
And Vermont residency requirement, is that based on, is there a timeline associated with that? Like person has to be a resident, they're just present in the state, they're living in the state, period, now.
Yeah, there isn't a residency limit.
Okay, thank you.
So this is quick telephone. Go ahead, the income guidelines. So this just give you a sense of who is presently eligible for childcare financial assistance. So family size of 3 or less. The line going across is the gross monthly income. And so that's where you see that, the people at the highest level of income making about $80,000 a year are still eligible for some. And then their weekly family share is the change that we made this summer. Instead of having a co-payment per child, the state has moved to now you have a family share. So of all the children that you have in care, we assess what you can afford to pay based upon our capped rates. And so that goes from having a $0 a week family share up to $200 presently. So just to give a sense of the landscape, currently the Child Development Division supports approximately 20% of the overall population accessing childcare. This equates to about 6,700 children. However, we are responsible for regulating all childcare slots, and the capacity that we have out there is about 28,000 slots. So predominantly, it is private families who are engaged in childcare, and the state is just supporting that other 20%, helping them pay for childcare. I thought it would also be helpful to just show what has happened over the last several years in terms of the number of children receiving childcare financial assistance. As you will see, we've had a significant decline during the pandemic, and the decline really hasn't rebounded at this time. It has remained pretty steady, around 6,000 children, and that does kind of have an ebb and flow to it, but we aren't back up to supporting as many children as we once had.
Yeah, please.
Okay, thank you. Is there a slide in here that talks to reasons why that might be, or can we make guesses as to why that is, or?
So we do have guesses. We also have a report that will be coming out next month that will give us a little more insight into that of why programs are. So it could be a program has closed, and so there isn't capacity there for children. I think what we don't know is what families during the pandemic. We know a lot of work did shift to being able to telework, and so what is the need for care? So I think there's a lot of anecdotal. I'm sure that you've heard whether or not there are slots available or whether or not families need it, if they can afford care or not. There's a lot of factors, but I think what we've seen is we haven't gotten back to the pre-pandemic. We are using through the Child Development Division $5.4 million of our American Rescue Plan Act funds to increase slots across all age groups. So we were able to do that with some of our discretionary funds. And so we have both Let's Grow Kids, who is a partner in increasing the capacity for the younger age groups, and then Vermont After School, who is helping us with trying to increase the school age slots.
So do you monitor the number of seats statewide by license, or is that something that you actively monitor?
Yes.
And how often do you have an indication of what those numbers are? How often do you?
I think we have a slide for the number of the capacity. slot, you mean the number of slots that are in the state in general?
Right.
If there's a. Oh, those are
I don't
programs.
have it on this one.
Or was it right before? So the slide before, I think, shows the number of slots, the capacity by age. The slide before right there. So those are the number of slots available in Vermont by infant, toddler, pre-K, and school age. So about 28,000. And then just remember that 6,000 to 6,200 are just CC FAP. The rest are most likely private pay.
Thank you.
I don't know, who's in charge in a moment. I think it's striking that of the 28,000, more than 11,000 of them are school age slots. And those would be after school and summer school. I'm assuming like summer programs. Yeah,
So I will caveat that not all summer programs need to be within our regulatory framework. So I don't think that we necessarily have like the greatest sense of what is available. That's a part of what we're trying to do with Vermont After School is to encourage more of the summer programs to accept CCFAP so that children have and families have more choice.
Mhm.
But right now, how our regulations are written, they don't need to follow the regulations because of their short duration.
Mhm.
So this is really capturing like the before school, the after school, the school breaks capacity.
Not necessarily the summer.
Right.
Got it, I see. It's still pretty striking compared to only 2,900 infant slots.
Right. And I think, as you probably know, a lot of this comes down to ratios. You can have a lot more school age children than you can have infants per one adult.
Right, and this is exactly the problem we were trying to get at with the bill.
First, I'm back. Thank you for being here. And I know where we are. So Senator Weeks is still helping me figure out where we are, and we'll just keep going. You're presenting your PowerPoint. That's great. Thank you both for being here.
Yes, thank you for having us. We had just shown a slide about the number of children and how it has declined. And has really been steadily declining.
That's too bad.
Yes. This is another slide that just breaks out by federal poverty level, the number of children and families that we are serving. So predominantly, the number of families that we're serving currently don't have a copayment or a family share. I think that was about 60% fall into that category. And then it moves up.
The zero family share are the reach up, are the foster care, and then there's the ones that fall, who aren't those, fall under 150% poverty level. So just a caveat that it's a good chunk of our population, which is noted at the bottom there.
Wait, can I just ask a clarifying question?
Yeah.
I don't know who's in charge.
Go ahead.
But Senator Lyons. So yeah, I just want to underscore that point. So the 100, I'm putting on my own screen, the zero copay, that's 4,600 of the 6,700 kids are not paying, their families are not paying anything. Most of them are reach up and foster kids
And then there's a group that do fall in the FPL level, federal poverty level, that are below 150 families that are in reach up or are in foster care that are also receiving a $0 family share.
Okay.
So it's kind of those three populations.
Yeah, okay, great.
I guess I will also just in case it isn't obvious, so we assess that they shouldn't have a family share, but we also have a capped rate. So whether or not the family pays anything is between the program and the provider. So if we say that we pay $300 for your infant, but they charge $400, that $100 difference does have to be paid. But that is strictly between the family and the child care program.
Oh, I see, yeah.
So that it's always just an important nuance, because I think it looks like we're saying they have no family share, but you might hear from constituents that say, but I do.
Right.
And that is where we aren't able to support them outside of what we have established.
That's important. Thank you.
Do we know how many people are affected by that?
Don't, unfortunately.
Yeah, because we hear it from time to time.
I think it's important to note too that, you know, the CCFAP and the private pay the same amount too. So, you know, it's a requirement that the providers can't charge more or less between the two populations. But we don't have an idea. Sometimes there are scholarships available that the providers give to the to any of the kids so that they don't have to pay that difference. You know, whether they have 2 kids in care, you know, maybe it's a sibling discount type thing. And we kind of reference that like a co-payment. We try to keep the terms a little bit separate so that above and beyond is like a co-payment for the family, and then this for the CCFAP is family shared. That's sometimes hard to grasp.
Okay. And you're keeping track. Do it.
That is what we are. We get to do it every single day, so
Yes.
it makes it easier. So if there are specific questions about kind of the eligibility of childcare financial assistance, I thought we would move into the budget. And so we'll just do that, but happy to go back if that was to questions. So currently we have federal funding of $25.8 million approximately. I would say approximately because with federal funding, it depends on the children that we're serving and whether or not they meet the eligibility criteria for that program. So we have the Child Care Development Block Grant, which is the grant that we receive directly from the Office of Child Care. We also receive Temporary Aid to Needy Families Social Services Block Grant. So this TANF, known as REACH up here in Vermont. So we do get some funding from them as well. We also have the Family Services Division federal funding. So children that are eligible because they're in family services custody or otherwise eligible for family services, also foster care eligibility or child welfare services of the Social Security Act eligibility. So those are the 3 primary federal funding streams that we have that go into this. We also have a small portion of global commitment. So the Medicaid funds that go into like therapeutic childcare. Also, once again, if a child is eligible. And then we have state funds about 36 million. And the state funds, I just want to make sure, are both our general fund, and then we also have a special fund currently that goes into that mix. And I can speak, I can tell you what the special fund is, but not speak a lot about it, but it's the earned income tax credit is presently a portion of what goes into our state funds. I think
So for each of these, maybe you could talk a little bit about how eligibility determination, are you going to talk about that later?
so you want to know like the hierarchy?
The hierarchy, yes.
Yep, so yes.
Actually, I did bring that, believe it or not. So basically when eligibility is determined, it will look at foster care first, if the family's in foster care. If family's not in foster care, it looks at like family support, which is another title 4E or 4B funds. So basically it looks at foster care first, then it looks at REACH up, TANF, that TANF SSSBG, and then any other service need that might be able to fall under federal funding. And then it goes to state funds if it's not any of those above categories. Certain income guidelines, yeah.
And if we did an overlay of the kids that we're talking about in each of these categories with the slide that you had earlier with the age groups, how would that, I mean, do you do that and kind of figure out where we are with respect to age?
So if I could ask a clarifying question, so you're kind of saying, let's take the infant population and how many of those are funded with each grouping?
You do that, or is that
We can-
overkill?
I mean, we can try. We can try to do that. I don't think we have done that. But we can look at to see if we can.
I don't know whether it is meaningful or not. I just, it's a question I'd like to.
Just trying to think what
It's too
could
difficult to do.
come from that.
What benefit would we get from looking at that?
Right, that's what I'm trying to, yeah,
Me too.
yeah.
I do think one of the the bullets that I probably should read, just say out loud, is that our federal funding sources are already being fully utilized. So I don't know if we're thinking there was a way to bring in more federal funding, and there's not. So those all come with caps. So yeah, we do try to make sure that we are utilizing all that money first, but there's not a way to grow it per se.
Yeah.
Because if we are capped out in one of those, then it definitely will go to GF
So
too.
it goes to the next.
Yeah.
Which I think would be the
GF is
struggle.
general fund.
Yes, sorry. I apologize.
That's okay.
We live in
I
acronym,
got that
in
one,
an acronym world.
surprisingly.
You're catching on. By the end of the session, you'll just be.
Slowly but surely.
Questions?
Then, the last piece that we were asked to talk about was the type of childcare programs that we have. So we have the registered family childcare homes, licensed family childcare homes, which we're gonna get you that definition of like what makes them distinct. Then we have the center-based childcare programs, non-reoccurring, or like, we have some ski resorts that offer childcare. So families the adults can go out and ski and their children can be watched. And then we have,
Sorry.
did they come out awkward? Sorry.
What did you say?
So the adults can go out and ski.
I know. Well,
I'm not a skier, so.
that's an important aspect of one's life, wellness, right?
And then we have center-based childcare programs, and then we have after-school programs. And this just shows what the capacity is. I think what's important to note is the money that we have been using, our American Rescue Plan Act discretionary funds or childcare development funds, is how it allowed us to be able to do some capacity building to like offset some of the closures that we have seen throughout the pandemic. The September 22 would probably be smaller as opposed to being more in line with the 2021. I believe that is all that.
So the loss of 200 programs in 5 to 6 years. Any analysis on why? Causes of?
So we have, that is one of the reports that will be coming next month that will give us a little more insight. Otherwise, I'm just giving you anecdotal. Okay, yes, and we'll make sure that we share that with the community.
Can you go back to slide 5? What are the STARS program, 2 through 5?
Yeah, so that's currently our quality rating information system, so that, and we call it STARS, which is our step ahead recognition program. So that is right now a program that is somewhat paperwork intensive for programs to complete and show like what are different classes they take, what are the credentials that their staff have taken, maybe what methodologies they bring into their center. And then there's a group who looks at their application and determines what their stars are. They have to be reviewed every 3 years. During the pandemic, we kind of put a pause on people having to do their reapplications. We just kind of said like, here you are, unless you wanted to go up in stars. So if you were a 3-star program, but you're like, I've done a lot of work and I want to be a 5-star program, then we have found a way to be able to assess them because we didn't want to harm anyone. But this is a way to kind of give the families a sense of the quality of the childcare program that they're engaged in, and that is currently how we set our rates.
Okay, so does that apply to both private and public schools? So they're both rated in stars?
Yes, so to the only publics predominantly, I want to make sure that I'm not misspeaking. So I'm like, I don't believe that we have a center at this point in a public school that offers something other than UPK, but I'm just putting little asterisks just in case I'm misspeaking. But like, so to be a UPK program, you have to have, I believe it's 4 or 5 stars. So that is that connection there.
So this is current program. I believe, if I understand S56 correctly, the stars aspect essentially fades away and it's more of a seeking to attain a quality level of childcare across the board. Is that correct or not?
If the bill doesn't do anything with the STARS program, it doesn't touch the STARS
So it's
program.
maintained.
Yeah, I mean, there may need to be, if the bill were to pass the way it is, there might be modifications to it, but it doesn't, we didn't address the STARS program in the bill.
My misunderstanding.
That's okay.
Thank you.
So the administrative, yeah, it sounds like it's administratively burdensome. Is that for the agency or for the child care center or both?
The childcare center.
Yes, okay. And is it because there is a limited IT accessibility and communication, or is it paper driven or?
It is paper driven.
Yeah.
Is my understanding, and it's just a lot of documentation, and not necessarily a lot of support to compile all that documentation. So certainly an added stress during a time when we know that a lot of child care center directors are in classrooms leading children, just because of their staffing shortages. And so this would be an work that they need to do in addition to when they don't have children, which is just a lot.
What kinds of things are they keeping track of for the oversight and review?
May I get back to you with like the full list?
Sure.
Okay.
I mean, we can find it on the website perhaps, or?
Well, and I guess I would say it's just that we have tried to not, during the pandemic and as of late, because we are trying to move through a revision of the regulations to just allow us to come into best practice.
Okay.
And so I will be able to perhaps tell you about what the system is, but we are hoping to shift it and have been adding supports with our American Rescue Plan Act fund. Sorry, I know I'm saying a lot, but we have tried to really find a way to capitalize on how can we use those funds. So we have put out to bid a program for quality coaches, and which would be folks that would help programs with what are your goals, what would you like to be able to take for different courses, and to connect them to them, to help them through that process rather than saying like you go through the process and then tell us when you have completed it. So, and I know that will be coming, I believe LCAR is in March when we will be presenting. Yes. Yes.
Oh, good.
Yes,
How
but
thick is it? That's all I want to know.
no, I think it's actually pretty
Pretty
simple.
lean. Okay.
It's, yeah, I
Don't
want
say
to say
simple,
it's
never
like,
say simple.
yeah, lean. We'll go with lean. If like, I want to say it's like 5 pages or less, to be
Okay.
perfectly honest.
We'll look forward to that. We are so looking forward to that. Okay. Good. Go ahead.
So if I were a provider or a parent or in the state legislature, and I needed to understand stars 1 through 5, is there a link that is available to just?
Yes, so I'm happy to give you what we have. I just, and then also happy to also get myself a little bit more brief. We have some vacancies within the Child Development Division. And so normally I could have some others join me, but right now I don't have that. So I need to just get someone that wouldn't normally be joining me for testimony to feel either more comfortable joining or to be able to kind of brief me enough. I'm sorry, I'm talking like high level. I'm just gonna say I don't have a policy director currently or the systems director who would oversee this body of work there on leave.
Okay, that's fair. No, I'm just curious, what it means to jump from one level to the other and what, just get a sense of administration necessary to do such a movement. And are these STAR programs, are they, what's the right word, like validated, like they provider provides answers, but
Yes.
who checks?
There is a system that we are working within, but that is also what we are looking to revamp. I think before we used to have a contract with an entity where I think we had maybe a handful of people who went and were trained in a specialized way to be able to do this rating. And we were looking to see like, how do we have some of this expertise, but also allow for more capacity within our system to do this. But we can certainly, I'm happy to get you more information.
And just, again, because I don't have the background, how long has the STARS program been in effect?
I want to say you have a sense? I was gonna go with 20.
Yeah.
A long time.
A long time.
20+ years, yeah.
I think it's pre-2000.
Yeah.
Yeah.
I think it's the late 90s.
Yeah, I was gonna say.
Yeah.
right. Kind
It
of.
predates me.
Me too, yeah.
Okay, thank you.
20 years, yeah.
But happy to, and I think what we're looking to do is just the way that regulation is written now, it's hard to make any adjustments with best practice. And so if it was established in the 90s, what we know is that nationally there is a different best practice that we want to move forward. And that's like a focus on engagement between the providers and the children, not necessarily on, well, I don't want to misspeak and upset the world that could be watching. So.
Carry on.
Thank you.
This is a newbie question, but I guess I never thought to question the STARS program. Has it been problematic? Are there, sorry, I'm not clued into that, but, because normally, I mean, I've worked in education, so normally this kind of like certification is helpful and useful.
I think it can be useful. And I think where it became burdensome is when it became so paperwork intensive and for programs to be able to get through it. And so you don't necessarily have to either. You can say, like, I'm good with being a 2-star program.
So it's the administrative side that is really problematic. Okay.
And I guess the question is, there's a 3-year review and how, in different certification processes, it's a 5-year review or however it happens. So we'll look forward to the report that's coming out, the rules that will be generated. Go from there. That's good. And anything you have that can help shine light on just the criteria that might be utilized for determining STARS levels would, I think, be very helpful. Don't have to go into full depth on it at this point because you are changing it.
I just sent the link to the website to everybody.
Good, thank you. Okay, any other questions about STARS? That was a good
Sure.
side trip. It was a great side trip. Good, all right. Okay,
I think that was all the slides that we had. So I'm happy to continue sharing or stop sharing and see if there are other questions.
let's just go back to the last slide that you have on the types, program types and the changes over the past 6 years. And I'm looking in particular at the decline, the COVID decline, let's call it. How much, so do you have kind of an analysis of where people are now as a result of at least an appearance of emerging out of the whole pandemic? Are we going to see any centers recouping?
I'm gonna go
Recovering, I guess.
I'm not sure, and I don't want to speak because I think it is challenging. They are private programs, and whether or not they have the right amount of staffing to be able to have the full capacity of children that they could start to generate the revenue that they would need. I feel like those are all, we have done things. We have the student loan repayment program. We have the current student scholarship program, which is more successful to date than the prospective student scholarship program. There's actually some language that we're proposing to move away from that just because there were some challenges with the funding stream to try to help support
Increase
those.
the flexibility.
To move the funding, essentially the prospective student, we have to recapture the funds as the legislation is right now, and we can't do that because.
That's for the BAA.
Yes,
Yeah.
yes, exactly.
The Budget Adjustment Act.
So we have tried to help where we can. We had the retention bonuses, the $7 million that was passed last year that we've been putting out to try to help childcare programs, but I'm not sure, if they would say that they feel like that they are ready to rebound. And I guess I would be remiss to not take this opportunity to just also mention that we have been putting out the American Rescue Plan Act stabilization funds to childcare programs since last October. And the final payment goes out this month. So that is funding that the childcare programs will no longer have access to. We've had some programs who've had it and had, stopped serving children, if they were summer programs, et cetera. So they kind of ebbed and flowed. But that is another loss that I feel like childcare programs are going to be feeling after this month. They won't have that.
So we'll find out if there's a cliff.
Yes.
Yeah.
And there has been, and I don't have it in this presentation. I'm trying to think of where I presented it. Like the amount of funding that we have provided is significant. And so it is a cliff.
Might be helpful to send that along to Alex so we have it. For a couple of reasons. One, we're looking at this decline, and we've also seen we're seeing a decline in kids, but it's not a one-to-one relationship. It's not a relationship. There's a relationship a little bit, but not cause and effect. And so what funding is available and who it's helping and who it isn't. This is a tough place for us. I mean, it's really a crisis. I call it a crisis right now because of the lack of childcare services available and what's going on with our workforce, folks who can't access childcare.
And we'll have a bit of a,
No, go ahead.
okay, I'm going to say we'll have a bit of a delay. So I think that's what people want to know is like, what did the stabilization funds pay for? But we have said programs don't need to let us know that until their final report.
Yeah.
And to try to make it as simplistic as we could so that people could access the funds, but that also gives I'm not gonna have an answer for you, like how were the funding put towards operational costs or were they put towards wages? I won't be able to share that for a bit, which is, I know, also a challenge.
Well, we'll just stay connected. I mean, as we go through the childcare bill, AHS, CDD, a lot of folks will be back with us looking at the implications of the bill and how it might change what we're looking at. So this is just to give us some grounding in where we are. Senator Weeks and then Senator Hardy.
Yeah, thank you. So my training, I've always been taught to focus on the exception rather than the standard or the steady state. Clearly, registered FCCHs are where the drop is occurring. It's radical, and the question is, in our upcoming testimonies, are we focusing on that sector so we understand what the drop is?
We can ask that question.
Okay.
We can ask that question.
Because it looks like a very unique experience. Everything else is stable, relatively stable, and even in some cases, slight growth, but they're small numbers. I'm really curious what's impacting that section.
Good question. It's a question. Can you answer that or can you provide us?
I can give you very high level and get you further information, but I do know, I believe this is where I was before going to 2016. I believe just 2016 is when we did our licensing regulation revisions. And there were changes that were made that did impact the registered family childcare homes. But because this predates me and Carolyn, our time with the Child Development Division, I would want to have the opportunity to go and to be able to give you specific, like here were the changes. And this is what we are assuming has impact here, but I mean, we don't have a direct correlation. But
I just, one more thing on the STARS program, just because I was Googling, trying to find out when it started and I couldn't find it out. But just so you guys know that there are STARS programs in most states. It's not anything to Vermont. When I Googled it, it was like Kentucky STARS, Oklahoma STARS, Texas STARS, Minnesota STARS. So
It's an incentive program for improving the quality
of
yeah.
childcare nationwide, not just here.
And every parent would want to go to a 5-star program for their children, right?
So that's what they need.
Right. Yeah. They're looking at the rating of the particular student.
I think that also comes to what's available in your area, which is a challenge and inequity.
And two, like if a 2-star is just overwhelmed with paperwork, it could be just as good as that 5-star, but they're just like, they can't put that paperwork in. Or, there's barriers or challenges for them.
So will the IT system that we've been investing in, will that help with this? think we have an IT system for, I think it's more for eligibility, but certainly does it extend to some of the eligibility for STARS programs?
So you are absolutely right. Right now it is maintaining our eligibility. So what we have built is to move our eligibility over, and then the goal is to continue building out. So we will move everything that's in our Relic system, Building Bright Futures, into our CDD information system. But that will give just a little bit of time.
How much time do you think? A couple of years, 3 years, 4 years? That.
Yeah, I think what we have found with the eligibility system is it was far more complex to build that. I hope that maybe these additional modules that we need to build are not as complex. But IT systems are a lot of work to build, as it turns out.
Who knew?
Yeah, well, kids, it's really important. You know, you don't want to have any little kid falling through the cracks.
Absolutely.
Okay, you've given us a lot of information. Are there questions, just going back, any questions about the funding process? The administrative process, where things are? Did you talk a little bit about the different requirements for family-centered homes or other childcare facilities? Did you talk about that when I was out?
We did not, but that is what Senator Weeks was asking for, like, what is the difference between the registered and licensed family childcare homes in particular, and that was where I said I would follow up and give the very
Okay.
distinct,
So we're gonna
this is
get
what it takes to have the addition.
good, and then STARS,
Yep.
be part of that. Okay. Anything else? Anything else that we need? And you're gonna bring us the solution for fixing all of this as we go through the bill. We're glad
We're happy to be a thought partner.
Yeah, be part of the system, part of the process, so, thank you. I think that unless you have something else and there are additional questions, we've really gone through this pretty well. Thank you. This is the second time we've had an opportunity to look at this.
Can I just ask a question? At the beginning, you said you were also going to talk about the I can't remember what it's called, the immigrant child,
The non-
the
yeah.
non-citizen. Thank you.
Sorry, and I did glaze over
Did
that
you
quickly.
mention that?
I think it was just to highlight right now that it is not a part of our system
Right.
because it is not allowable for the federal system.
Okay, so you weren't going to get into
The
the
bill,
language in
yeah.
the bill about that new program. I see. Okay.
No, we're holding that. We just wanted to get
I see.
on the ground floor, so now we are there. Now, next step is the bill. That'll be great.
So going back to Miranda's comments a second ago, the tension between federal and state in regards to what the federal government allows and what the state government allows. Is it, I'm not sure who the right person is to kind of get a sense of.
What's your question?
The question is, well, Miranda alluded to a tension between federal government allowing, not allowing.
Right.
But then the state comes along and allows.
Right.
You know, what happens at that junction?
You're talking about the relationship between federal law and state law, and it have different effects depending on the federal law, and then the state can always do more, we can't do less. And do you want to speak to that? Because I see you nodding your head, and then Katie will be able to help us when we, as well. Katie, do you want to chime in on this now, or?
Sure.
Yeah.
Katie McGlynn, Office of Legislative Counsel. So it's a matter of funding. So as you saw, some of the funding for the existing CCFAP comes through a federal block grant. So there are restrictions on how those funds can be used, whereas the same restrictions aren't on GF funds. So if the state would like to enact a non-citizen program, it would have to be through a separate pot of state money.
Okay, very good. That's all.
Which is what is in the bill. Yeah, so that would add a part of the fiscal note would include that cost as we go forward with the general fund, and that ultimately whatever the cost is, decision made down the hall based on our policy recommendation. Do you want to add anything else on the federal versus state?
That's great, thank you.
Okay, great. Okay, anything else? Covering a lot of ground here, which is good. And so, thank you both. I think we're good with that testimony. Where? This committee has been known for finishing early. We're not quite finished. We'll just stick around the table for a little bit and then just want to share with you that tomorrow and the next day, if you can look at the agenda with me briefly. I didn't get a chance to talk about our agenda on Friday, which I usually like to do, give you a heads up. So tomorrow and Thursday, we are looking at S37, which is the reproductive shield protection, provider protection bill. So we'll look at that 2 days, and we have a significant amount of testimony lined up. And I know there are others who want to testify, and we may add them in where you see TBD stuff. And then on Friday, we're going to begin some in-depth testimony related to the child care bill. So we've invited some national experts in to talk with us about what we have in our state and how it looks as compared with nationally. We won't do compare with Sweden, but just look at where we are nationally.
Is the agenda that's on the website the new one that was emailed to us?
I believe it is, yeah, and I'll double check with Alex to finish, so that's good. And then we'll be moving along on these two bills, are kind of priorities for us. We want to move along on these bills, and then we'll be picking up some other bills. And at some point in the next week or couple of weeks, we'll be going through some of the other bills that have been put up on the wall. So we'll try to keep leapfrogging along, making progress. And thank you very much, Commissioner and Director. It's a pleasure to have you in here.
Thank you for having us.
All right. So good.